to the first of probably many.
Or none.
Or none. We could all be gone by then. Town halls focused on Medicaid. My name is Gill. I'll be moderating the town hall. And for main man here, you want to introduce yourself? All right, so the agenda is really simple here. We're going to start just kind of laying down the ground rules. Steve's going to go into a presentation on Medicaid, and then we're going to have a period for questions, answers, and share back, where you can kind of tell your stories, your struggles, or kind of ideas. And the idea is that anything we talk about, we can kind of use towards either organizing or as a topic for the next town hall. Sound good?
Good.
All right. So agenda review, check. Introduction, check. All right, so rules. We just asked that everyone here seems like a good egg, but just in case there are any alt-right agitators in the audience.
Get him out.
Yeah.
I'll leave.
Leave right now, you save the picture.
Shame.
So we just ask that you just participate with intention. You're here, you're present, pay attention. If there will be chances to kind of talk back and respond. We just ask that you keep your comments and questions relevant to the topic at hand. Respect people who are sharing, no interruptions, no back and forth, and respect the time in the room. You know, this is a very passionate topic, but this is not your March on Washington, I have a dream speech moment. So we will hand you the mic, and we ask that we can get it back before we have to turn the lights off at the end. We also ask that you respect the space. We see that there's a lot of equipment here. The church has been very kind enough to trust us with all this stuff. We ask that you respect the space and not kind of destroy anything or steal anything. Because I work for the church and it'll cost me my job, so please don't. Please respect the space. And thank you for that. And kind of the goal, before I go to Steve, the goal is to deliver facts about Medicaid and the political situation evolving around it. And then Steve is also going to go kind of discuss the implications of these Medicaid cuts. And then we'll open up to the room to discuss how to organize in the face of healthcare. And I'll just say this, that it's a scary time, it's a frustrating time, but it's times like this where we learn who we are as citizens, as people, as activists or new activists or potential activists. And moments like this, times like this, events like this are where we can come together as citizens and kind of work towards solutions versus waiting for somebody to deliver solutions to us. So thank you for your attendance. Thank you for your attention, your time, and I'll throw it to going over your hand over the meeting started.
Yeah, thank you. Thank you, everyone, for coming tonight. I know the weather isn't the best, and we're all feeling a certain kind of way today. When I got about a month ago, I had rethought July 1st, it would be too late. We felt that this bill would have been passed and signed already. So, perfect timing. It is passed today. Brief history of Medicaid. Medicaid was enacted in 1965 by President Johnson to supplement Medicare. Medicare is for seniors over 65 years old. Medicaid is for people who are low income or disabled. Medicaid is for people who essentially cannot work, therefore cannot afford health care. We all know America is a for-profit healthcare system. Medicaid is meant to balance that out. It's very difficult to be enrolled on Medicaid. One of the biggest rules for Medicaid is that you cannot have more than $2,000 in the bank at any time. If you have $2,001 and you lose your Medicaid, and you must reapply, which can take up to 3 months. If you get married, you most likely will lose your Medicaid because your income is now part of your spouse's, which then will effectively put you over that $2,000 asset limit. A lot of people said that with the Obergefell Supreme Court case to legalize same-sex marriage, we have marriage equality. We do not. Disabled people cannot get married without losing their health care. Now, to give context on disabled people and Medicaid. Medicaid is the only form of health insurance in America that covers long-term care. Long-term care. It allows people like me to pay other people to take care of me so I can live in my own home. And that prevents me from living in a nursing facility, which we all know is a death factory where health insurance organizations charge way too much, and they'd rather do that because they get more money back. Even though it is cheaper for the government to have me live in my own home than it is to put me in a nursing home. That's something we'll get to later. But because of the long-term care, disabled people are virtually forced to have Medicaid. Therefore, because of the $2,000 limit, disabled people are one, forced to live in poverty, and two, are unable to get married. Now, I just have to update my notes because I have here the GOP wants to cut, so it's without precedent or passed. Today, as I'm sure everyone is aware, the Senate, by one vote, passed H.R. 1, which now cuts almost $1 trillion from Medicaid over the next 10 years. The yearly federal budget for Medicaid is $880 billion. They don't want to just cut it. They want to border it. And they want to leave all of it, all of the costs, up to the states. Now, the way that Medicaid, but also, sorry, they also cut $200 million from SNAP, food assistance. Now, the way that they're going to do this is through two ways. The first, work requirements, where they're going to force, quote-unquote, able-bodied people to work a certain amount of hours per month in order to be eligible for Medicaid. But that is part of their trap, because they know that the average American is not aware of that $2,000 limit. So now, these people who are going to need Medicaid are going to be forced to get a job. And that job will most likely give them more than $2,000 at a time, which will then rule them ineligible for Medicaid. It's all by design. It's all a trap. And the other part of this is that now, in order to remain on Medicaid, you must prove your eligibility every 6 months. Now it's every 12 months. I'll give you a quick story about my experience with this 2 years ago. It was October of 2023. And it was my time to prove I'm poor and disabled. And yes, for every 4 months, someone from the government comes to my house to make sure I'm still disabled. That's where we're at. That's where your tax dollars go. Even though I'm only going to get worse, but there's no option to check that off. So, October 2023, it's my time to reapply. I printed out over 400 pieces of paper to prove my assets and my disability. 2 weeks later, I got a letter in the mail saying I was kicked off Medicaid because they said I did not submit one form. Now me, I'm a producer. I'm a movie producer. I keep track of everything. I went back and I found the exact form that they said I gotta submit. They lost it. But the burden was on me. So I reapplied. Another 3 months go by. Now, this is during the winter. COVID still around. The flu everywhere. And I have no health insurance. I am one illness away from financial ruin. Just like the millions of uninsured people in this country. So I submit another 400 plus pages of documents. And this time, they call me up. And they say, Steve, you forgot a form. And I said, check again. And magically, that form appeared. I don't blame these people. It's not their fault. They are severely underpaid and understaffed and overworked. And again, that is all by design. And now, those offices, which is their Social Security offices, are even more understaffed. And those employees are now even more overworked. So again, they want the system to fail. So people will not become approved for Medicaid. Right? People like to say, the system is broken. The system is not broken. It is working exactly how they set it up. It's working by design. And this is what they're doing. Everything is a trap. They want people to work, to make too much money, where they are not poor enough for the ACA exchange. but they don't have enough money to not be eligible for Medicaid. And the other part of it is that people who are enrolled in Medicaid through the Affordable Care Act expansion are now going to be kicked off. For the simple fact that they live in a red state with a red governor, and they didn't like President Obama. There's nothing more to it. The Congressional Budget Office projects 17 million people are going to lose their health care because of the bill that was passed by the Senate today. Just to give you some context into where that money is going, people like Elon Musk, Jeff Bezos, will get even more money. ICE now has a yearly budget 3 times larger than the yearly budget of the United States Marines, than a branch of our military. Their budget is no larger than the GDP of 100 countries around the world. Now, we need to call this for what it is. I have 2 words for it. One, socialism. And don't get me wrong, I am a card-carrying socialist. But the next time someone tells you can't have single-payer health care because it's socialist, point out this bill. Because this is a redistribution of wealth from poor people to rich people. Just because it's going from the bottom up instead of the top down doesn't mean it's not socialism. The other word that we must use for this is eugenics. There is a reason why disabled people remain targeted. It's all by design. People like me are just dollar amounts or data points. Right? There's a reason why Doge went into Social Security and Medicare and Medicaid in their first meetings. To get information on how much money this country's most vulnerable population is costing the federal government. They want to get rid of us because we are expensive. Even though in reality we're not. Go down the line. I've already been doing this my whole life. What's going to happen now? So the way Medicaid works is that it is funded by the federal government and the individual state governments through what's called FMAP, the Federal Medical Assistance Percentage, and that is based on states per capita. So, red states, Florida, Alabama, Texas, will receive a greater percentage of federal dollars as opposed to states like New Jersey, New York, California, because our per capita is much, much larger. At minimum, the federal government must reimburse states by 50%. At maximum, it is 83%. So if you are the richest state in the U.S., for every $1 that Medicaid spends, you will receive half of that from the federal government. If you're in the poorest state, you will receive 83 cents per every dollar spent. That is going to change radically and drastically. It gives you context between poor states and red states. I am on long-term care through Medicaid. I receive 64 hours per week of paid care. That means I can pay people 64 hours from my Medicaid provider. That's about average for New Jersey. I have friends in Florida who are objectively as disabled as I am, if not more. They receive 10 hours per week of paid care. And this time next year, that will probably be done. Simply because they do not want to keep people like me in their own homes. Because again, the health insurance corporations make more money putting people in nursing homes. That is all about the profits. A lot of people have been telling me not to worry. They're only going to take health care away from the illegals. Undocumented immigrants are not eligible for Medicaid. That's a fact. I don't care what anyone says, but it's simply not true. Medicaid or healthcare cuts, austerity cuts, do not discriminate. Everyone will be affected. Very, very soon. Now, those were the facts. I want to get into the messaging behind all this. My very good friend of mine, Tim Faust, he wrote a book on this, and it's called Health Justice Now. And I encourage everyone to read it. He has a phrase that I really want to share. Temporarily able-bodied. That means if you live long enough, you will have become disabled. But that's just a fact of life. Everyone will become disabled at some point in their life. Which means you may rely on Medicaid at any time in your life. Medicaid is an investment. An investment in people. An investment in society. I am an actor. I'm a comedian. I've been doing stand-up comedy for 15 years. I just performed at the Beacon Theater in New York City. I get to travel the country, speaking to groups like y'all. I wouldn't have that without Medicaid. I wouldn't be able to have any quality of life. What I want to do, what I want to do, without Medicaid. I am an active member of society because of Medicaid. Right, you probably would see me all around town. I wouldn't have that without Medicaid. It keeps me healthy. It allows me to have people around me at all times to ensure my safety and my well-being. Medicaid provides that. It is cheaper, again, cheaper, to keep me in my own home, to be with my people, than it is to put me in a nursing home, which almost guarantees death for people like me. I have already lost friends because they were forced to move into nursing homes. And that is going to happen a lot more starting next year. Medicaid is a form of infrastructure. Right, we think of bridges, tunnels as infrastructure. Medicaid is another form of infrastructure. It is social infrastructure. It allows the poor black single mother of 2 children to have health care while working a full-time job and take care of her children. Medicaid allows a farmer in the middle of Iowa to get his medications when his nearest hospital is an hour away, even though this bill is going to shut down that hospital very soon. Medicaid keeps a trans woman safe from going to a doctor that is homophobic and transphobic and will not listen to that patient and may cost them their lives. Medicaid keeps us alive, it keeps us healthy, but it keeps us thriving. Millions of people in this country, and almost everyone in this room, who do not have Medicaid now, may need it tomorrow. And you just don't know it yet. Everyone is one illness, one injury away from becoming reliant on Medicaid. Not anymore. The American government is supposed to be of the people, by the people, for the people. It's in that document that the Supreme Court puts in the shredder every week. But I know we don't forget that. They're supposed to be there for us. And yet, their first target is this country's most vulnerable population. But not just the most vulnerable, but the most, largest minority. Disabled people are 1 in 4. We make up 25% of this largest population. And yet, we are the first target. Because to them, we are the most expensive. Because to them, our lives are not worth the price. And compromising our lives with the lives of the most vulnerable people doesn't serve the people. What's the point of having a just society if the most vulnerable are not taken care of? If we are left behind. That is not a just, equitable, or fair society. When President Trump signs this bill, says, I got no more faith. He's going back to the House tomorrow. And I do not trust any of them to do the right thing. So when he signs his bill, you will be signing a death warrant for untold amount of people in this country. All in the name of tax cuts for the richest people in the country. So, we gotta say no. We can't allow this to happen. We can't. The time for playing nice is over. I remember when they go low, we go high. Going high, it didn't save my health care. So this is where I get rattled. And I say, fuck all that. Because I'm tired. I'm tired. I don't want to be here tonight. I want to be home. Drinking. I'm not gonna drink now. Oh shit, I need a drink. But I have to. Because the burden has always been on us. The people. The average citizen. We gotta remind them that they work for us. Because we forget that. We get complacent. I don't blame us. Shit sucks. Surgery sucks. Every day is a different risk. It's 5 different risks. Every day. But we can't get distracted. There's a reason why Trump went to Florida today to talk about the ICE detention center with the alligators. To distract us. It is all by design. They know exactly what they're doing. They're not stupid. They're not ignorant. But they are smart, calculated people. But we are better. As a group, we are better. So we must have solidarity with each other. I'm not just doing this for myself or my disabled brothers and sisters. I'm doing this for the Black community, the LGBT community, the rural community. I'm doing this for all the people I don't agree with politically. Because this is healthcare. This transcends everything. And we are better than our political differences. We are better than our differences in ideology. They are doing this on purpose. They want to lie to us, divide us, and distract us. I don't love it. It absolutely worked. But I don't blame us. It is not our fault. We're tired, I'm tired. But we can't stop fighting. So now, it is up to us to look after one another. I don't mean to get depressed. But a lot of people are going to die. A lot of people are going to suffer. And we have to be there to help people. Look for the helpers. And the helpers are us. We must be there to help people. Especially, we gotta help ourselves. Because the second we lose sight of all this, game over. There's no coming back. And I know everyone always says, well, just vote. Just vote. If you don't like it, just vote. I'm sorry, that's not enough. Voting got us here. If voting was enough, we wouldn't be in this room today. And that's what we must organize. Right? It goes beyond calling your representative, calling your senator. Don't get me wrong, that works. It does work. But it cannot end there. We must protest. We must educate. We must share our stories. And we must organize. Like-minded people, scared people, motivated people. I know we don't want to fight back, but we don't know how. And that's by design. They make it hard for us. They scare us into protesting. When I performed at the Beacon Theater on Saturday, not going to Hill, I was there. There was a man arrested at Columbia University by ICE because he spoke up about Gaza. And that's meant to scare the rest of us. And I'm scared. I'm scared too. I went to the airport recently, and I had the most intense security screening of my life. And my first thought is, am I on a list? Probably. That's all. But I'm scared. If I go to New York, and I want to protest, am I going to get arrested? Last week, an entire group of wheelchair users were arrested by Capitol Police. No one is safe. But to that, I say we resist. Because we outnumber them. We outnumber those fascists, the secret police. We can overwhelm them. But we cannot do it if we don't do it together. If we don't do it without solidarity. A lot of people don't understand what that word means. To me, solidarity is helping people. Even if it doesn't help yourself. But you do it for the greater good. 2 years ago, I was on strike. I'm an actor and a writer. But then, the hair and makeup unions went on strike. The set and the props people went on strike. The Teamsters went on strike because they had solidarity with us. And we won. And we would not have won without the solidarity. And I apply that to real life. We cannot win without solidarity, without organizing. Zorba Mondas, a guy no one heard of 4 months ago. He's on the Democratic nominee for mayor in the biggest city in the country. Because people organized. It is possible. We can do it. And it is never too late. But now is the time. And the time was yesterday, but now is the time. Organize, resist, and fight. Solidarity forever. Thank you all of you for coming tonight. Sorry, Mr. President.